Hello, this is Dr. Osland from Southern California Chiropractic, and I get asked a lot about adjusting somebody's neck or cervical spine. And today I'm just going to kind of go through my process of what I'm thinking as I'm working on somebody and what I'm actually doing. Okay, so when somebody comes in and they have a neck problem, they have pain or their neck's not moving correctly and it's causing pain down the arms, whatever it is. So when I'm looking at their neck, I will, if we have the benefit of x-rays, I'll definitely look at those, but as I'm working on somebody, it's a little more dynamic than just looking at some x-rays. I feel the muscles and I'll feel for tight, tense muscles, and then I'll kind of work on them a little bit and see if the vertebrae underneath them are moving, because sometimes you can have tight, tense muscles, but the vertebrae underneath them are moving okay. So that's a little bit of what we call motion palpation. You kind of motion the vertebrae and see if they're moving okay or they're not moving okay. So we want to find out if they're not moving, which way aren't they moving? Say they're stuck to the right, we're going to move them back to the left. If they're stuck to the left, we're going to move them back to the right, because we want every vertebra moving optimally. That way you have proper function of your neck, and you're less likely to be in pain and have dysfunction. So once I find a vertebra that I want to move, say I want to move it from the right to the left, there's a lot of different ways to adjust people, and I've heard people also ask me about what type of adjustment is better than others, because you can do this seated, you can do it laying face up, you can do it laying face down. And my answer is most chiropractors are pretty well schooled on their own technique that they use. The one thing I would say to stay away from, if you see anybody that's getting adjusted in a lot of rotation, like they're turning the person's head just and really thrusting into rotation, that's not appropriate. So you definitely want to I do what's called more of a lateral break. So it's just more of a lateral flexion, and it's not a rotational type move. And then I get asked about the noise also, which I think is very interesting. And they've done studies on this, and the noise is actually nitrogen gas that is, it's called cavitation. And it's nitrogen gas that gets pulled out of the fluid that's inside your joints that gets resorbed in the next 20 minutes. So it's just kind of a interesting noise, and it just signifies that we've gone to, that's where we want to get to, the paraphysiological space. So we reset all the muscle spindle and Golgi tendon organs that are in the muscles and ligaments and things around, and tendons around that are in the muscles that are around the neck. So we want to get to that spot. So it just kind of signifies that we got that we've achieved what we want to achieve, but it's not actually anything breaking or bones breaking or anything like that. It's just actual noise coming out of the joint.